Well, it has been the opportunity to engage with other European stakeholders, to work together, trying to enhance the change European health systems have to proceed with, so as to deal with the challenge of aging and chronicity in Europe. I think that there are a lot of experiences all around Europe that can be helpful for people who want to improve their health systems. But transferring those experiences, those good practices to other systems is again a huge challenge. And the idea of using implementation science and new methodologies so as to be able to deliver on the real world, on the ground, is something that we are keen to try to involve and to, at the end of the day, implement. The opportunity to engage with high-quality partners gives us an opportunity to learn, to improve our own knowledge and methodologies in our field of experience, which I said before is implementation science. So JADECARE has been a wonderful field to improve in these areas. But besides that, the Basque Country has been working on digitally enabled integrated healthcare for the last 10, 12 years, and sharing our experience with other partners in Europe has allowed us to see ourselves with other people's eyes. And we have had the opportunity to learn about our strengths, our weaknesses, and opportunities for further improvement. So altogether, it has been quite beneficial for us as Chronic Uni Institute of Health Services Research, but also for the Basque public health care provider, Osakidetza. Yeah, I would say those are in summary, the great benefits we have having in JADECARE. With JADECARE, we expect that health authorities can improve their healthcare systems for the benefit of patients. We expect that new experiences, new innovations will be implemented on the ground in different countries in Europe, and that those innovations and improvements will, at the end of the day, yield benefits for the patients. For our chronic patients who will benefit of these digitally enabled integrated care, continuity of care, responsiveness of the health system to their needs, and so on and so forth. Moreover, one of the key pillars of all the original good practices in JADECARE is improving the capacity of patients and caregivers in making decisions, in sharing decisions with healthcare professionals about their own health. In fact, what we try is to empower patients. So at the end of the day, all the different local good practices that are being implemented in the different next adopters, as we call those pilot sites who are improving the systems, I hope that they will yield those benefits. By the way, we have a very robust evaluation framework, so we will see at the end of the joint action whether these desires, these aims have been achieved. In the future and currently, I think that the big challenge for improving digital enabled integrated care in Europe is having all the relevant stakeholders, not only at European levels, but also at country level, regional level, local level, involved in all the actions that are needed to improve the systems. So getting all those stakeholders, those people who have the power to make decisions or have the obligation to make decisions is a challenge. But apart from that, any change is a challenge itself. And we are talking about big changes coming from reactive healthcare systems to proactive systems who provide longitudinal care for these chronic patients, which is not what the healthcare systems have been designed in the first place. So it's going to be difficult, but I think that up to now, with the experience of JADECARE up to now, the local good practices that have been designed by all the Nexa doctors fulfill our expectations, and we are quite optimistic that they will deliver at the end of the day. The ultimate challenge will be the sustainability of those local good practices. In the context of this COVID-19 pandemic and all the economic challenges that all healthcare systems have, it will not be easy, but I hope that if we deliver, people will be convinced that it's necessary to proceed on this way.